the top 7 vitamins to increase and decrease prostate size. Greetings from our video. The top 7 vitamins that can reduce the size of an enlarged prostate are discussed in this video, encompassing their health advantages, food sources, and suggested daily consumption. Now let's get going. A larger prostate, that is also referred to as BPH, or benign prostatic hyperplasia, is a prevalent ailment that many men experience as they age. The primary job of the prostate, a gland behind the bladder, is to secrete a substance that facilitates the movement of sperm during ejaculation. Men's prostate glands can expand with age, which can cause a range of urinary problems. Urine exiting the body through the urethra may be pressed against by an enlarged prostate, resulting in a range of symptoms like poor urine flow, trouble starting to urinate and frequent urination, urinary tract infections, dribbling after urinating, and partial bladder emptying. Although not fatal, an enlarged prostate can have a significant negative impact on a man's quality of life. Let's now examine the top 7 vitamins that have the ability to both shrink and grow the prostate. As a brief reminder, the only objective of this video is education. Therefore, if you have any medical concerns, consult your physician. Number 1. Vitamin D. One crucial mineral that is necessary for sustaining bone health is vitamin D, lowering the risk of chronic diseases and controlling the immune system. But new studies have indicated that vitamin D also has a major effect on prostate health, particularly in shrinking an enlarged prostate. We will now investigate the relationship between prostate health and vitamin D, and talk about how this vital vitamin can aid in the reduction of an enlarged prostate. According to one study, males who have low vitamin D levels had a higher risk of prostate cancer. It is believed that vitamin D regulates the proliferation of prostate cells, which may aid in stopping the growth of an enlarged prostate. Furthermore, vitamin D has anti-inflammatory properties, which may aid in lowering prostate gland inflammation and shrinking an enlarged prostate. According to one study, males with BPH who supplemented with vitamin D, compared to individuals who did not take the supplements, had a marked decrease in prostate size. According on an analysis of multiple studies on the impact of vitamin D on BPH, vitamin D supplementing was linked to a notable decrease in prostate volume and an improvement in urological symptoms. The research also discovered that study participants accepted vitamin D supplementation well, and it was safe. It is believed that by decreasing inflammation in the prostate gland, vitamin D helps expand and shrink the prostate, which may aid in the prostate's shrinkage. Furthermore, vitamin D may assist in controlling the proliferation of prostate cells, stopping their uncontrollable growth and division. Even though solar exposure can cause the body to create vitamin D, many people do not obtain enough of the nutrient from sunshine alone. Additionally, the body's capacity to generate vitamin D can be impacted by a number of variables, including age, skin tone, and geographic location. To confirm that you are receiving adequate vitamin D, it's critical to have a diet high in vitamin D or to take a supplement. Egg yolks, fortified meals like milk and cereal, and fatty seafood like tuna and salmon are examples of foods high in vitamin D. Additionally, commonly accessible, vitamin D supplements come in liquid and tablet form. If you think this information is useful, just take a moment to subscribe and hit the like button. Number 2, vitamin E. Vitamin E functions as an antioxidant within the body and is a fat-soluble vitamin. Numerous foods, including as nuts, seeds, and leafy greens, naturally contain it. Research has been done on vitamin E's ability to lessen BPH symptoms and enhance prostate health. The following are some ways that vitamin E can both expand and shrink the prostate. 1. Anti-inflammatory qualities. It is believed that inflammation contributes to the development of BPH. Studies have demonstrated the anti-inflammatory benefits of vitamin E, which could aid in lowering the inflammation that promotes the prostate gland's growth. Men with benign prostatic hyperplasia, BPH, who took vitamin E supplements reported prostatic inflammation was significantly lower in individuals who took the supplements than in those who did not. 2. Antioxidant properties. Strong antioxidant vitamin E aids in defending cells against harm from free radicals. Free radicals are unstable model killers that have been connected to the onset of BPH by causing oxidative stress. via scavenging off free radicals. Prostate gland growth may be inhibited or slowed down with the use of vitamin E. 3. Hormone control. One hormone that affects the growth and development of the prostate gland is testosterone. Hormone imbalances can cause BPH in some people. Hormone levels have been demonstrated to be regulated by vitamin E, which may help lower the risk of BPH or delay its advancement. 4. Increased blood circulation. One possible factor in the development of BPH is inadequate blood supply to the prostate gland. Because vitamin E has been demonstrated to increase blood flow, it may help lessen the symptoms associated with BPH. If you would like to give vitamin E supplements for BPH a try, seek for a premium supplement from a reliable manufacturer. For adults, 15 milligrams of vitamin E per day is advised. However, greater dosages can be required for medicinal objectives. Make sure you adhere to the directions on the label. Number 3. Vitamin C. Changing one's diet and way of living is one strategy for managing an enlarged prostate. Vitamin C is one supplement that has been shown to be helpful in the treatment of BPH. Commonly referred to as ascorbic acid, is a water-soluble vitamin present in a variety of fruits and vegetables, containing bell peppers, broccoli, strawberries, kiwis, and oranges. Here are a few methods that vitamin C can aid in the reduction of an enlarged prostate. Vitamin C aids in the prevention and treatment of BPH by lowering oxidative stress within the body. Attenuating inflammation can aid in symptom relief. Strong antioxidant vitamin C aids in the body's defense against free radicals. Unstable chemicals called free radicals have the potential to harm cells and have a role in the emergence of conditions like cancer, heart disease, and BPH. Vitamin C aids in the prevention and treatment of BPH by lowering oxidative stress within the body. Collagen synthesis, which is vital for the prostate gland's functioning, depends on vitamin C. Collagen is a structural protein that gives tissues flexibility and support. And preserving sufficient collagen levels can aid in preventing prostate gland growth. It is thought that hormonal abnormalities, namely an elevation in dihydrotestosterone (DHT) levels, have an impact on BPH, a hormone that encourages the prostate gland to develop. It has been discovered that vitamin C aids in hormone regulation and lessen the prostate gland's size by lowering the conversion of testosterone to DHT. Research has indicated that taking supplements of vitamin C may help lessen the symptoms of BPH. Men with BPH who received 500 milligrams of vitamin C every day for 6 months as part of a randomized controlled experiment saw a notable reduction in their urological symptoms as compared to the placebo group. According to another study, individuals with BPH who had blood levels of vitamin C greater were less likely to acquire prostate cancer. 4. B6 vitamin. Vitamin B6, usually referred to as pyridoxine, is one such natural therapy that has been demonstrated to be useful in decreasing an enlarged prostate. Water-soluble vitamin B6 is essential for numerous body processes, such as the metabolism of amino acids, the synthesis of hemoglobin, and the generation of neurotransmitters like dopamine and serotonin. Numerous foods, such as fish, poultry, potatoes, avocados, bananas, and fortified cereals, contain it. Research has indicated that vitamin B6 can help men with BPH experience better urination and a smaller enlarged prostate. These are a few possible mechanisms of action for vitamin B6. There are anti-inflammatory effects of vitamin B6. Urinary symptoms may result from the prostate swelling and pressing on the urethra due to inflammation. Dihydrotestosterone DHT imbalance is the hormone that is hypothesized to be the cause of BPH. Vitamin B6 transforms the amino acid tryptophan into niacin, which aids in the regulation of hormone levels. This is necessary for the production of sex hormones, including testosterone and estrogen. The synthesis of neurotransmitters like dopamine and serotonin depends on vitamin B6, which play a role in the nervous system's control. Better nerve function might lessen the symptoms of BPH related to urine. The effects of vitamin B6 on BPH have been examined in a number of studies using a double-blind placebo control trial. For a period of 12 weeks, 200 males with BPH were given either 50 milligrams of vitamin B6 or a placebo every day. Comparing the vitamin B6 group to the placebo group, The results revealed a substantial decrease in prostate size and an improvement in urinary symptoms. According to a different study, males with BPH who took magnesium and vitamin B6 along showed reduced urinary symptoms and a significant decrease in prostate size as compared to those who received a placebo. Although vitamin B6 seems to be useful in lessening the sensations associated with urination and shrinking the size of an enlarged prostate, it is noteworthy that excessive consumption of vitamin B6 may pose a risk. For men over 50, 1.7 milligrams of vitamin B6 should be taken daily, and dosages more than 100 milligrams daily may result in neurological side effects as tingling and numbness in the hands and feet. Number 5. Zinc. Maintaining the health of the prostate depends heavily on zinc, an important element. According to studies, individuals with BPH frequently have less zinc in their prostate tissue than men without the condition. Zinc supplements have also been demonstrated to help grow and shrink the prostate, as well as reduce BPH symptoms. These are some of the ways that zinc can both expand and shrink the prostate. Zinc prevents the conversion of testosterone to dihydrotestosterone, DHT, and has anti-inflammatory properties. DHT, however, may be a factor in certain men's prostate enlargement. Zinc can aid in preventing testosterone from being converted to DHT. This may aid in shrinking an enlarged prostate and preventing prostatic development. An immune system in good health requires zinc. Research demonstrates that men with BPH possess less zinc in their blood and prostatic tissue than do men without BPH. Zinc supplements can boost immune system performance, which helps lower inflammation and decrease an enlarged prostate. Prostate cell apoptosis, or cell death, has been demonstrated to be induced by zinc. This can stop the prostate from growing further and help it shrink and enlarge. It is advised that men consume 11 milligrams of zinc daily. Higher zinc dosages, however, may be more useful for reducing an enlarged prostate, according to certain research. The zinc dosages employed in these research range from 50 to 100 milligrams per day. It is noteworthy that excessive consumption of zinc may have negative effects. High zinc dosages might have adverse effects such as diarrhea, nausea, and vomiting. Apart from supplementing with zinc, there are several lifestyle modifications that may mitigate the symptoms of BPH. Among them are 1. Reducing alcohol and caffeine intake. Alcohol and caffeine can aggravate bladder irritation and exacerbate symptoms of BPH. Reducing the amount of these drugs you use may help ease your symptoms. 2. Consuming a lot of water. Drinking enough water can help lessen BPH-related urinary discomfort. 3. Maintaining a balanced diet. Consuming a diet high in fruits, vegetables, healthy grains, and lean meats can help lower inflammation and promote prostate health. 4. Frequent exercise. Exercise can help lower inflammation and enhance urination. Number 6. Selenium. Supplementing with selenium is one possible therapy option for BPH. Soil, water, and certain foods naturally contain the mineral selenium. It is crucial for numerous body processes, including as antioxidant defense, thyroid hormone metabolism, and immune system function. According to studies, taking supplements of selenium can help lessen the size of an enlarged prostate and ease BPH symptoms. Here are a few ways that selenium can aid in the reduction of an enlarged prostate. Because of its strong antioxidant properties, selenium can scavenge dangerous free radicals that can cause cell damage. Can aid in the emergence of numerous illnesses, such as BPH hormonal imbalances, are directly associated with the development of BPH, aiding in the restoration of hormonal equilibrium and halting more prostate growth. The immune system is supported in large part by selenium, which may aid in lowering inflammation and stopping the development of aberrant prostate cells. Research has indicated that supplementing with selenium can enhance immunological function in males suffering from BPH, lowering swelling and enhancing prostate health. One of the main contributing factors to the onset and course of BPH is chronic inflammation. There are anti-inflammatory effects of selenium. Selenium has demonstrated additional health benefits in addition to its potential benefits for prostate health, such as boosting heart health, enhancing thyroid function, and lowering the risk of some cancers. It's crucial to remember, though, that taking supplements of selenium should only be done under a doctor's supervision because taking too much of it can be harmful. Adults should consume 55 micrograms of selenium daily, while 400 micrograms is the most amount that is safe to consume. Number 7. Saw palmetto. Saw palmetto's ability to lessen BPH symptoms and minimize the size of an enlarged prostate has been the subject of much research. What you need know about saw palmetto's advantages for prostate health is provided below. Numerous active substances, such as fatty acids and phytosterols with anti-inflammatory and anti-angiogenic qualities, are present in saw palmetto. These characteristics may aid in lowering dihydrotestosterone (DHT) levels and prostate gland inflammation via reducing DHT levels. Saw palmetto has the potential to alleviate BPH symptoms and shrink the prostate gland. Saw palmetto's anti-inflammatory and anti-androgenic qualities are complemented by antioxidant properties that can guard against oxidative stress and damage to the prostate gland. What is the conclusion drawn from the research? The results of numerous research examining saw palmetto's efficacy in treating BPH have been encouraging. A 2018 meta-analysis of 27 randomized control trials revealed that saw palmetto was noticeably more successful compared to a placebo and enhancing BPH patients' flow rate and urine symptoms. The study also discovered that saw palmetto had little adverse effects and was well tolerated. Saw palmetto was shown to be as effective in another study that was published in the Journal of Urology, like the prescription medication finasteride, which has been shown to lessen BPH symptoms over a 2-year period. But compared to the finasteride group, the men and the saw palmetto group had fewer adverse effects. Overall, the evidence points to saw palmetto as a potentially useful and secure therapeutic alternative for men with BPH who want to substitute natural remedies for pharmaceutical ones. Saw palmetto comes in several forms, including as liquid extracts, pills, and capsules. Selecting a premium saw palmetto product that includes standardized extract of the plant is crucial. This guarantees a constant concentration of reactive substances. Saw palmetto dosage recommendations vary based on product and ailment being treated. Nonetheless, the majority of research has employed daily dosages between the 100 and 6,320 milligram range. Consult your healthcare provider before beginning any new supplement regimen, particularly if you are taking medication or have a medical condition. We appreciate you seeing our video on the best 7 vitamins for reducing prostate enlargement. We sincerely hope the material was instructive and helpful to you. Even so, there are numerous treatment choices such as medication and surgery. Additionally, consuming vitamins can help lower prostate gland size and alleviate discomfort. Including vitamins in your diet such as zinc, selenium, saw palmetto, beta-sitosterol, vitamin C, vitamin D, and vitamin E can aid in enhancing prostate health and possibly shrink an enlarged prostate. Sustaining a nutritious diet and regular exercise can also help with prostate health in general.